Hello and welcome. Is your heart trying to tell you something? Long before a serious cardiac event occurs, our bodies often send out subtle signals. Some you can even see in the mirror. Understanding these warnings is one of the most powerful steps you can take toward protecting your long-term health. Heart disease is the leading cause of death for both men and women in the United States. It's a sobering statistic, but it's not a final sentence. A significant number of these outcomes are preventable, and that prevention starts with knowledge. It starts with learning to listen when your body speaks. In this video, we're going to break down 14 key warning signs. We'll start with 7 signs you can actually see on your body, some of which might surprise you. Then, we'll cover 7 classic symptoms that you can feel. And finally, I'll give you a simple, powerful action plan to help you protect your heart health, starting today. Before we begin, a quick and important reminder. This video is for educational purposes only, and is not a substitute for professional medical advice. If you are experiencing any of these symptoms, especially chest pain, severe shortness of breath, or sudden weakness, please consult a healthcare professional or seek emergency care immediately. Alright, let's start with the surprising signs that you can actually see on your body. We'll count them down from number 7. Number 7, Frank's sign. This refers to a diagonal crease or fold in your earlobe. It might seem strange, but for decades, studies have noted a correlation between this earlobe crease and an increased risk of atherosclerosis, which is the buildup of plaque in your arteries. The theory is that a loss of blood flow to the tiny vessels in the earlobe can cause the tissue and collagen to collapse, forming this crease. Now, this is very important. Having Frank's sign does not guarantee you have heart disease. Many people with the crease are perfectly healthy. However, its presence, especially in individuals under the age of 60, is considered a statistically significant marker for underlying coronary artery disease. If you notice it, it's not a reason to panic, but it is a very good reason to have a conversation with your doctor about your overall cardiovascular risk. Number 6, hair loss on the legs, ankles, or toes. If you've noticed that the hair on your shins, ankles, or toes has thinned out or disappeared completely, it could be more than just a sign of aging. This can be a sign of peripheral artery disease, or PAD. PAD is a condition where the arteries that supply blood to your limbs become narrowed or blocked by plaque. Just like the hair on your head, the hair follicles on your legs need a steady supply of oxygen and nutrients to grow. When blood flow is restricted, these follicles can't thrive and eventually die off, leading to smooth, hairless skin. Other signs of PAD that go along with this include shiny skin on the legs, feet that are cold to the touch, and very slow-growing toenails. Number 5, xanthelasma. This is a medical term for soft, yellowish, fatty deposits that form on or around your eyelids. These aren't pimples or styes, they are actual deposits of cholesterol under the skin. While they are harmless on their own, xanthelasma are a powerful external signal of what might be happening inside your body. About 50% of people with xanthelasma have high cholesterol, but even more telling, research has shown that the presence of these deposits is an independent risk factor for heart attack, atherosclerosis, and heart disease, even in people with normal cholesterol levels in their blood tests. Think of them as a visible warning sign that your body may not be processing cholesterol correctly. If you see these, a blood lipid panel and a discussion with your doctor are essential. Number 4, arcus senilis. Sticking with the eyes, arcus senilis is a gray, white, or bluish ring that forms around the outer edge of your cornea, the clear front part of the eye. Like xanthelasma, this ring is also caused by fat and cholesterol deposits. The context here is all about age. If you're over 60, seeing this ring is quite common and is generally not considered a major health concern. It's often just a normal part of the aging process. However, if this ring appears in a person under the age of 45, it's a much more significant finding. In younger individuals, it's a strong indicator of severe high cholesterol and high triglycerides, often due to a genetic condition called familial hypercholesterolemia. This puts that person at a much higher risk for heart disease at an early age. Number 3, cyanosis. Cyanosis is a bluish or purplish tint that appears on your skin, lips, or nail beds. This happens when the blood circulating near the surface of your skin is low in oxygen. Oxygen-rich blood is a bright red, which gives our skin its healthy pinkish tone. When oxygen is low, the blood turns a darker bluish-red color, and this shows through the skin. Of course, your fingers might turn a bit blue if you're out in the freezing cold. That's a normal response. But if you notice a persistent bluish tint in a warm environment, It's a sign that your body isn't circulating oxygenated blood properly. This can be caused by serious lung problems or by heart conditions like congestive heart failure, where the heart is too weak to pump enough oxygen-rich blood to the rest of the body. Number 2, non-healing ulcers on the feet or ankles. An ulcer is an open sore on the skin that is very slow to heal, or doesn't heal at all. When these appear on the toes, feet, or ankles, they can be a critical sign of severe peripheral artery disease. For any wound to heal, it needs a robust supply of oxygen, white blood cells, and nutrients, all of which are delivered by your blood. If the arteries in your legs are severely blocked, that area is starved of the necessary blood flow. A small cut or blister that would normally heal in a week can instead turn into a persistent, painful ulcer. These arterial ulcers are a sign of very poor circulation and require immediate medical attention to prevent serious infection and tissue loss. And the number one visible sign your heart may be in trouble is swelling in the legs, ankles, and feet. This is medically known as edema. While occasional mild swelling can happen after a long flight or a hot day, persistent swelling that leaves a dimple when you press on it, called pitting edema, is a classic sign of congestive heart failure. When the heart becomes weak and can't pump blood forward effectively, blood can back up in the veins. Gravity then causes this excess fluid to leak out of the blood vessels and accumulate in the tissues of your lower extremities. You might notice your shoes feeling tight, your socks leaving deep indentations, or just a general puffiness in your legs and ankles that worsens throughout the day. This is one of the most common signs that brings people to a cardiologist. Now that we've covered the signs you can see, let's move on to the classic symptoms you can feel. These are often the most direct messages from your heart, and they should never be ignored. Number 1, shortness of breath with exertion. This isn't about getting winded after running a marathon. This is about feeling unusually out of breath during activities you used to handle easily. Maybe it's climbing a single flight of stairs, carrying groceries, or walking up a small hill. If you find yourself having to stop and catch your breath when you didn't before, it could mean your heart isn't able to pump enough oxygenated blood to meet your body's demands during activity. Number 2, a persistent cough or wheezing. A cough is usually associated with a cold or allergies, but a chronic cough, especially one that produces a white or pink frothy mucus, can be a sign of heart failure. This happens when fluid backs up into the lungs, a condition called pulmonary edema, which irritates the airways and triggers a cough. Wheezing that isn't from asthma can also be caused by this same fluid buildup. Number 3, needing to prop up to breathe at night. This is a specific type of shortness of breath called orthopnea. It's when you feel breathless shortly after lying down flat. People with this condition often find they have to sleep propped up on 2, 3, or even more pillows just to breathe comfortably. When you lie flat, the fluid that may have pooled in your legs during the day can shift back into your chest and overwhelm your lungs. Waking up suddenly at night gasping for air is an even more severe form of this and requires urgent medical evaluation. Number 4, unexplained fatigue or severe weakness. We all get tired, but this is a different level of fatigue. It's an overwhelming sense of exhaustion or a heavy feeling that doesn't go away with rest. When the heart can't pump enough blood, the body diverts it away from less vital areas like the muscles in your limbs and sends it to the brain and heart. This can make simple daily tasks like showering or making a meal feel completely draining. Number 5, waking up frequently at night to urinate. This is called nocturia. While it can be a sign of other issues, it's also linked to heart health. During the day when you're upright, excess fluid can accumulate in your legs due to a weak heart. When you lie down at night, gravity is no longer a factor, and that fluid can move back into your bloodstream. Your kidneys then go to work to filter out this extra fluid, filling your bladder and waking you up multiple times to urinate. Number 6, pain or cramping in the calves while walking. This specific symptom is called intermittent claudication. It's a cramping, aching, or tired feeling in your leg muscles, most often the calves, that reliably comes on after you've walked a certain distance. The pain forces you to stop. After a few minutes of rest, the pain goes away, and you can walk again until it returns. This is essentially angina of the legs. The muscles aren't getting enough oxygen during exercise due to blocked arteries causing the pain. And the number 1 felt symptom of heart trouble is chest discomfort. Notice I said discomfort, not just pain. A heart-related issue doesn't always feel like a sharp stabbing pain. It's often described as a feeling of pressure, squeezing, tightness, fullness, or burning in the center of the chest. This discomfort can last for more than a few minutes and may radiate to your shoulders, arms, especially the left, neck, jaw, back, or even your stomach. It can happen with physical exertion, or even at rest. This is not a wait-and-see symptom. Any new, unexplained, or severe chest discomfort requires you to seek immediate medical attention. It is always better to be safe and have it checked out. Now, seeing all of these signs can be worrying, especially because for decades we've been told that heart problems and high blood pressure are all about the heart itself or clogged arteries. But what if the root cause, for many people, lies somewhere else entirely? Breakthrough research from top university scientists has now revealed that the real control mechanism for healthy blood pressure is often hidden deep within our kidneys. They've pinpointed a crucial signaling molecule that can become dysfunctional over time, but more importantly, they've uncovered how to support it using a blend of powerful ancient nutrients, including one so revered it was known as the nectar of the gods. If you are concerned about your blood pressure, your circulation, or any of the silent warning signs we've discussed today, I strongly encourage you to watch a free, special video presentation that explains this groundbreaking discovery. It could be the most important thing you do for your cardiovascular health this year. You can watch it right now by simply pointing your phone's camera at the QR code on your screen. A link will pop up. If you're on a computer or prefer to click, I've also placed a direct link in the pinned comment right below this video. It details a simple, natural method that is already helping thousands of people. It's crucial information. Now let's talk about the essential prevention strategies that everyone should know. Recognizing these 14 signs is a powerful tool, but an even more powerful tool is prevention. Here are the most important things you can do to protect your heart. First, get moving. You don't need to become a marathon runner. Aim for 150 minutes of moderate intensity activity, like brisk walking, cycling, or swimming each week. Consistency is key. Second, eat a heart-healthy diet. Fill your plate with fruits, vegetables, lean proteins like fish and chicken, and whole grains. Focus on reducing your intake of processed foods, sugary drinks, and unhealthy saturated and trans fats. Third, if you smoke, please quit. It is, without a doubt, the single most damaging thing you can do to your cardiovascular system. Quitting is hard, but it's the best investment you can make in your health. Talk to your doctor about resources to help you. Fourth, manage your weight. If you're overweight, losing even 5 to 10% of your body weight can dramatically improve your blood pressure, cholesterol, and blood sugar levels, taking a huge strain off your heart. Fifth, know and control your numbers. This means getting regular checkups to monitor your blood pressure, cholesterol levels, and blood sugar. These are the key metrics of your cardiovascular health, and working with your doctor to keep them in a healthy range is crucial. And sixth, understand your family history. If close relatives like a parent or sibling had heart disease at a young age, you are at a higher risk. Make sure your doctor knows this, so you can be more proactive with screening and prevention. Your body has a language. By learning to read these 14 signs and symptoms, you are taking an active and essential role in your own health. The most important message today is this: don't ignore what your body is trying to tell you. If anything in this video resonated with you or describes something you've been experiencing, please make an appointment to speak with your doctor. Early detection and proactive prevention are your absolute best defenses against heart disease. If you found this video helpful, please give it a thumbs up, subscribe for more evidence-based health information, and share it with someone you care about. You might just help save a life. What sign or symptom surprised you the most? Let me know in the comments below. Stay healthy, and I'll see you in the next video.